Well, the other day, I had to go to see my doctor. I was kind of worried about going to see him, wasn't I? See, about 3 or 4 years ago, I had a big operation. They call it open heart. You know what they actually do? They open your heart. Whereas, I always wonder, why don't they call some of the other procedures just plain English instead of all these fancy names? But that one they got right, didn't they? Open heart. So anyhow, I'm on all this medication. I'm supposed to go to the doctor every month to check my, what they call INR. Don't ask me what it stands for, but I've got to be between a certain level, don't I? Makes my blood thinner, doesn't it? Well, sometimes it will. My blood gets really boiling, doesn't it? You don't understand some things. Anyhow, so I went off to the doctor and I was afraid. I tell you why, because I was supposed to go every month. But I got so darn busy, didn't I? And I forgot to go. Well, I didn't really forget. I just thought, I can't be bothered, can I? There's too much trouble to go up there. And, well, anyhow, that was really stupid, wasn't it? Because as I walked in to see the doctor, I thought, blimey, I'm in trouble here, don't I? Well, there she was. It wasn't a doctor. It was my nurse practitioner. Remember her? Well, she's my nurse practitioner, Sandy Kay. She's a sweetheart. But on this day, I wasn't so sure she was going to be like that, was I? Anyhow, there she was. And around me right away, she said, "Where have you been?" I thought, God, she's after me already. Why haven't you been in to get your regular tests every month? Why didn't you get your lab work done? Why didn't you have a stress test? All right, Sandy Kay. I get it. No, you don't. We have a saying around called patient compliance. That means you've got to listen to what I say. Well, I said, remember, I like to ask questions first, but since I trust you now, so patient compliance. What does that mean, Sandy Kay? She said, it means you got to do what I tell you to do for your own goodness sake. And then she said, if I don't come in, there's a chance I might get one of those things called a stroke. Well, when you think about what's a stroke? Well, it's something to do with, your blood goes to your head and you bleed and you kind of get paralyzed and sometimes you even die. I thought, blimey, I don't want that, do I? Anyhow, she was trying to be cruel to be kind, as they say. Anyhow, she got on at me again and again and again. Anyhow, remember, patient compliance. Do what the nurse or the practitioner or the doctor says, because without it, you could be in serious trouble. So remember the term. It's a new fancy name, patient compliance. Do what the nurse or practitioner or the doctor says. Remember it, okay? Got it. Talk to you next week. Bye.